Two of them, Anderson, in critical condition. 9 of the patients were brought to the operating room. 2 of those patients were told have very serious, potentially limb-threatening types of injuries. The youngest patient here, just 3 years old, that patient was transferred then to Boston Children's Hospital. The patients, they tell us, range from teenagers to someone in their mid-60s. Once again, the nurse and several of the nurses that we've seen coming out, the doctor as well, some of them just stunned, just very tired, emotionally tired, stunned by what has happened. And that's what we've been seeing as we've come into the city of Boston. I spoke to one of the runners who was here, and she said they're still trying to comprehend, still trying to get their head around exactly what happened. She said, I crossed the finish line, and then I heard one loud explosion, and then we thought perhaps it was a celebration for Patriots Day. But then she said, her friend said, well, I don't see any cannons here. And then, of course, then there was this second explosion, and then very quickly, Anderson, they realized what had happened. So once again, here at the hospital, doctors working, doing what they can to save the patients that they have here. This is a hospital, once again, that is on lockdown. SWAT team here, a number of officers here as well, not allowing anyone inside who doesn't have official business. Anderson?
Yeah, Jason, I appreciate the report, and we'll continue to check in with you. And I mean, it just bears repeating what Jason said. A young patient as young as 3 years old, the oldest patient at that hospital, 60 years old. You had young people, you had elderly, you had families going out to cheer on their friends, their loved ones, their family members. You had residents, citizens of this great city just went out to cheer strangers, to encourage them on and to welcome them across that finish line when the bombs went off. I want to check in with our Sanjay Gupta. We are anticipating a press conference around 8:30. We're, of course, going to bring that to you live because we're trying to get you the latest information. It really will be any minute. We're going to bring that to you as soon as we can. But Sanjay, as we wait for this press conference, what are you hearing in terms of the types of injuries? Because, I mean, if doctors are dealing with ball bearings and the number of amputations we've been hearing about, what does that tell you?
Well, you know, we are hearing a lot about these lower extremity injuries as well, and that's suggests that the explosion was low to the ground. That sort of makes sense. This ball bearings thing that you first described, very concerning, obviously, Anderson. You worry about blast